and welcome to Medical Dialogues Journal Club. I am Dr. Nandita Mohan, and today I am going to cover the recent November edition, that is the 70th volume of the Journal of the Associations of Physicians of India. Headache is most common pain that is suffered by many. Now, tension type headache is the most common primary headache disorder. Now, as per the Global Burden of the Disease study in 2010, tension type headache is the second most common disorder worldwide with an estimated prevalence of close to 20.8%. Trigger factors have been widely studied in the context of migraine, but very few studies have actually investigated these trigger factors in the context of this tension type headache. So, to study the prevalence of these trigger factors and the associated disorders in this particular type of headache, the researchers conducted a study including close to a total of 400 patients over the age of 15 years, who all those were fulfilling the International Classification of Headache Disorders criteria of frequent episodic tension type headache as well as the chronic tension type headache. Details regarding their demographics, their headache characteristics, the trigger factors as well as the associated symptoms were all obtained. The associated, even the psychiatric disorders were also recorded. The results of the study did show that out of the 400 patients, 360, that is around 90%, were found to have triggers. The mean headache intensity on the visual analog scale was 6.7. The most common trigger factor was emotional stress among both males as well as females. There was a statistically significant difference in the frequency of the trigger factors between men and women for emotional stress, sunlight, sleep deprivation or insomnia as we all call it, noise, weather change, studying, fried food and even hypersomnia. Psychiatric comorbidity was found in 29% of the individuals, with sleep disorder being the most common factor. Tension type headache has been an underrated diagnosis despite being an extremely common disorder. The trigger factors are very less studied and their interactions are very even lesser known. So the diagnostic criteria as per the International Classification of Headache Disorders did make tension headache a diagnosis of exclusion rather than a positive diagnosis of inclusion. Therefore, the trigger factors must all be included in the diagnostic criteria, and associated psychiatric disorders should be sought for and treated simultaneously for better management as well as the quality of life. Chronic kidney disease is often characterized with slightly raised serum uric acid levels. Earlier, this urate level was actually thought to be an innocent biochemical marker of kidney dysfunction. But nowadays, urate levels are said to be a direct contributor to the kidney damage via its role in glomerular injury, tubular fibrosis, as well as glomerular hypertension. Now, there are several extraneous factors, dietary or otherwise, leading to a superstitious rise in serum urate levels. Now, this case study here describes one such dietary factor, that is soft drinks. Soft drinks are very popular non-alcoholic beverages that are prominent across all age groups in India. Market studies have shown exponential growth in the soft drink market all over the country over the period of the last 5 years. So the case study that I am mentioning here is of an 80-year-old man, a known case of chronic kidney disease, who actually presented with a sudden onset of right ankle pain and swelling. The kidney disease diagnosis was made, which was found to have been caused by obstructive uropathy secondary to prolonged urethral stricture. So his serum creatinine had remained stable over the last 6 months along with a normal blood biochemistry, and he was only on oral medications with no history of hemodialysis. The clinicians were at first baffled by this sudden enigmatic rise of the urate levels in his system. On further probing, it was revealed that during the ongoing heat wave, the patient was feeling very thirsty, and since his daily water intake was tightly regulated, he had started taking a popular brand of cold drinks occasionally instead of water to actually quench his thirst. So this change in his diet had occurred at the beginning of the summer month over the last 1 month. So the patient was advised to immediately stop all his cold drink consumption. He was also started on febuxostat 80 milligrams of daily dose. His uric acid levels did come down to 5.8 after a period of 3 weeks. The ankle pain also subsided. His serum creatinine levels also came down to as it was previously. So it was said that these soft drinks do contain a lot of harmful ingredients, including not only limited to fructose, fructose being the only carbohydrate which actually increases the blood uric levels, in addition to increasing the blood sugar levels as well. So usually this rise is asymptomatic and the levels usually come down with the cessation of fructose intake. But in cases like the one that I mentioned, this sudden rise may precipitate an acute arthritis attack as well. Thus, in CKD cases, it is advisable to avoid all these soft drinks completely. So in our country, there are a lot of misconceptions about the dietary restrictions in gout. They often tend to gloss over potentially harmful foods like soft drinks particularly. Thus, public awareness about the health effect of soft drinks must be raised. Cases like this are more likely to occur during specifically the summer months in India. Silicosis is one among the oldest occupational lung diseases known, that is actually caused by inhalation, retention, and pulmonary reaction to the crystalline form of silica. A variety of occupational exposures are associated with the occurrence of silicosis, that is mining, quarrying, cement, glass construction, ceramic, foundries, shipbuilding, rubber, cosmetic industries, jewelry, arts and crafts, sculpturing, dental materials, and many others. Several studies for many years have drawn attention to actually all this causing renal dysfunction and nephrotoxicity among the workers who are specifically exposed to silica. So this present study was conducted to actually evaluate the renal dysfunction among the Indian patients having silicosis and its correlation with the duration of exposure to silica dust. So the study included 52 eligible patients with a history of silica dust exposure, and silicosis did confirm on radiological examination. Investigations like their serum creatinine, their urine albumin, creatinine ratio was all done. The modification of diet in the renal disease formula was also used to calculate the GFR. So this study did show that 53.84% of the patients having albuminuria and a mean urinary albumin to creatinine ratio was also calculated. Isolated macroalbuminuria was detected in about 11.5% of the patients, while microalbuminuria was 42.3%. They also identified a significant association between the duration of exposure to silica dust and urinary albumin to creatinine ratio as well as the GFR. Hence, the researchers concluded that albuminuria as well as reduced estimated GFR in patients with silica dust exposure is not uncommon, and it reflects the early underlying renal dysfunctions. This study suggests a simple and cost-effective screening strategy for the early detection of renal dysfunction, specifically among silicosis patients, that may be considered as a tool to prevent further renal damage in such patients. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.